How many of you are members of, or that have gone to a neighborhood watch? Okay. How many of you have a lockbox on your house? Excellent. For those of you who do not have a lockbox, this is going to save your life. This is a box that the Fire Corps, which Doug Randall and myself are members of the Fire Corps, we're all volunteers, and they put these lock boxes on your home. It is not available to anybody but the fire department. What you'll do is you would pay $50 for the box, you would bring your key to the fire department, they would put the key in here, and they would lock it up. Then they'll take it to your home, and they will bolt it to the frame at your front door, or if you have a gate that's in front of your house, they will bolt it to the front of the gate. Because what happens is, if you call 911 and you cannot get to your door in order to unlock it, guess how they're going to get in your house? They're going to break in, whether it's through a window or a garage or a door, because they're going to try and get to you as fast as they can. But guess how long it might take? You called. Their response time is less than 5 minutes. But they waste time getting into your house. That's another 4 minutes that you could possibly have been laying there unconscious and not breathing. It literally will save your life. Okay, this has been tested under fire. I don't know how else they've tested it, Doug, but I do know that even if you're having your house remodeled and your contractor takes it off the wall and says, oh, you need to unlock this so we can get the key, and they won't do it. Okay, they cannot break into it. This is Doug. He's another one of my helpers here.
The other thing that I'd like to mention is these emergency lock boxes are for emergencies. They're not necessarily because you locked your keys in your car. Right. I'm going to tell you right now, we will not respond. We're not AAA, okay? They just can't do it. There's not enough of them. So.
For one thing, we're too busy.
Yeah, so, and of course, the only people that have a key is the fire department. No one else. So, but the other agencies that might respond to your home, they do have the key which represents our lockbox. In others, like Surprise and other areas, they have their own keys. So each key is different.
Right. And it's locked inside the fire truck. So if a fire truck comes and not the ambulance, there are 2 paramedics on every apparatus that leaves the fire station. They have access to the special lockbox where the key is kept that unlocks this, correct? Yeah. Okay. I'm sorry I didn't introduce myself. My name is Barbara Westenberg. I volunteer at the Fire Corps. I have Doug Randall, who's a volunteer with me from Fire Corps. Nancy Gerosi, who is also a posse member and assists me with my CPR classes here. Alan and Carolyn and Sally and Larry are all Neighborhood Watch. Alan in the back is a posse member, and he is certified as an instructor. I have Steve Carlson. He's also certified as an instructor. And then my wonderful IT guy, Joe Senatar. He's also a posse member, and he's a duty officer, and Steve's a duty officer also. You had a question.
Yes. Are you going to talk about the vial of life?
The vial of life is in the back.
Okay.
What you're going to do with the vial of life is you'll put the little sticker that says vial on your door or window that tells the fire department that you have it. Okay?
No, but I thought you'd want to explain it to them because I'm on our board and we hand it out to all new people.
Yes, and what it does is it has a sheet of paper in it, and it gives them instructions as to what medications are on it, the doctors that you go to, where you want to be taken if supposedly you have a special medical need and they need to transport you someplace else other than Del Webb type of thing. You would have all that on there. It's family emergency, your ICE information, who to call or who's allowed to be called. And also, if you call 911 and you have a do not resuscitate, that must be posted on your refrigerator. Yes?
That has now changed.
Oh, go ahead.
That will not work.
Really?
Okay? Paramedics come to the house, their job is to stabilize you, and that will be taken care of in the hospital.
Okay. Because it used to be if you have that orange certificate, I'm just going to say, they used to tell you if you have that orange certificate and you have it on your refrigerator and some family member calls 911 who doesn't realize you are no resuscitation, the fire would have that, but they still have to work on you and take you to the hospital. So the point is that if you are a DNR, which is do not resuscitate, do not call 911. You will have a hospice usually or a doctor. And family members will know it. You call the doctor will come out. Okay? Yes?
So we can take this into any of the fire departments?
What?
We can take our key in and get a lockbox in any of the fire?
No.
No.
It's going to be at the, go ahead.
Administration office.
Which is?
And he's got a card. I've got one too, but I'd have to dig it out of my file. Thanks, Doug.
Anybody else?
How often do you think you use those lock boxes? Very frequent?
A lot.
We're
Really?
told that they're used a minimum of once a day.
Oh my
or once
gosh.
a shift.
Yep.
Wow.
Okay.
I mean, that's what we're told.
Yes. We do have a lot of people here in our community that have nobody with them. Okay, they have medical issues. They may not have one of those special alarms, but even if they have the special alarm, if they can't get to the door to unlock it, they've got to get in somehow. Okay?
And what percentage of homeowners do you think have those?
Very few.
Oh.
Not enough.
Wow.
Exactly, not enough. I couldn't tell you exactly what the percentage is, but not enough.
I put two on my mother's houses when she moved to different places and they did not have a lockbox on it. I bought one for her birthday, one for Mother's Day, and then I told her, that's your Christmas present for the rest of your life. Because it saved her life. She needed to call 911 once, and they came and they had a lockbox on the house and they could get into the house and they could take her to the hospital. Okay? Yes, Doug?
And probably what's more important, if you might think, okay, well, we're in good health, but I'm to the store and Mom, my wife, for instance, she had a stroke. She was able to get to the telephone and call 911. And so they were able to get to her. But the other thing too, that we just remember, okay, she was alone, but the house was secured when they left. That's the other big advantage. If you have that key, you don't have to call a board-up company or something of that nature. The paramedics or the fire department, they'll close that front door and make sure that everything is secured just as they found it.
Exactly.
I have a question.
Sure.
If I have a cell phone, which I do, that's in Missouri, and if I couldn't get up off the floor, what would happen if that number came in through my cell phone?
If you have a 911 locator and you called 911, if you did not turn off where you are on your phone, and some people do that because they don't want people to know where they're at that time, they will be able to locate you using your cell phone.
911.
That's still correct.
Yeah, we don't really understand yet, because now, the other thing too is at the end of the month, we have to use all of our digits on our phone number. We have to use all the
623-584, yeah.
If you have a doubt about your 911 on your cell phone, because it may be from Mississippi or Vermont or somewhere, wholeheartedly encourage you to call 911 here but let them know right away what
It's a test.
your intentions are, and ask them, will my 911 reach you here? Because sometimes still, they won't respond to the local area that you're in. They'll go right back to where.
Thank you very much.
Yeah. And sometimes it's also where you are living near a tower also. Yes, ma'am.
Is there somewhere on the lockbox that would mention animals, if they're going in and you're worried about animals getting out?
We offer you a card that you could put your animals on it, and then you would put the vet or someone who would take your animal in case of an emergency, and you would have a phone number. Nancy is going to go get those cards for you.
And that's another good reason to have the liable of life.
Yeah.
If you have a neighbor or, another relative that's gonna take care of our furry forequarter, well, you can put that on there, because that's what it's for. And the Vial of Life is a national program. It's not just here. So
That's correct.
Well, gee whiz, these guys are special. It's a national.
Yep.
Well, I was thinking also, like, you've got the fire department coming in, and where there are animals, they kind of watch for them, don't let them get out,
That's correct.
okay?
Yeah.
Good work, okay.
That's why you'd kind of post it in a window by the front door, because that's usually the lock that they're going to come into.
Thank you.
Yep. Good questions. Okay. What you are going to be learning today is called chest compressions only CPR. It was started by 2 doctors, cardiac physicians, at the Sarver Heart Clinic down in Tucson. They found out that by doing this and teaching this, more people will respond and try to assist people because they don't have to deal with the yuck factor, okay? So we do not teach you respirations in this class. If you have small children that come and visit, or you have a pool or a spa, I would recommend taking a regular CPR course because children are different than adults. Children, you have to do respirations. In a drowning situation, you must do respirations, okay? We have a great fire department that responds under 5 minutes. So once you call, it takes them almost about 4 minutes to get to you because they have 2 paramedics on every apparatus. We have 3 stations that supply emergency aid through our community. One is across from Walgreens, that's 101. 102 is right here at Stardust and R.H. Johnson. And the third is 135th in Deer Valley. So they're strategically placed so they can make that fast response. 2 paramedics on the fire truck, and then an ambulance might come or an ambulance may not, depending upon what's going on. They may not have one available. They need the ambulance in order to transport you. Okay, and please don't refuse the ambulance because you can't afford it. The fire department offers a membership, and what is it now?
$85.
85?
I'm not gonna say how much it is.
Yeah. It goes up a little bit every year, but it's a membership. And it covers every family member that's living in your house. So if you have you, your wife, your mother-in-law, your daughter-in-law, whatever, living with you, it will cover them. Right there, the 3 ladies in that. Thanks, Doug. Yeah. So you can go to the administration office, which is at Spanish Garden. She doesn't need one. They're at Spanish Garden. They're kitty corner from True Value. They're behind that strip mall that has Nanjings in it, across from the animal hospital. That is the administration building, and you can get a application to fill that out, and it'll cover the ambulance fee that your Social Security or Medicare does not cover. But check, if you have secondary insurance, check with your secondary insurance because they may cover the expense that Medicare does not cover.
Is that a one-time fee?
Every year, it's annual. It's a membership type of thing. and it works great. And if you have to go to the hospital 3 times that year, it covers you the 3 times you travel. Okay?
And it covers everyone in the household.
I just said that, yes. Okay? Good, excellent. It doesn't cover you outside of Sun City West, though. I mean, if you go to Montana, it's not going to cover you there, okay? It's just going to be while you're here in Sun City West. All right, so we're going to start. Okay. What is primary cardiac arrest? It's an unexpected witnessed, seen or heard collapse of a person who is not responsive and is not breathing normally. Okay? If they are down and they're doing one of these, that ain't normal. Okay? Definition includes and is not breathing normally because the person could be gasping. I make good sound effects. Sudden cardiac arrest can happen at any age. You've heard the football player. A lot of people are taking this because they saw what happened on the field of the football player. They were able to save his life because of an AED and doing compressions. Okay? 15-year-old, 36-year-old, 14-year-old, 41-year-old, they were saved by people who knew CPR. Okay? Cardiac arrest, fact or fiction. Gender, male. Hate to break it to you, ladies, we want to be equal. We have equal opportunity in spades. The increase in women suffering from cardiac issues and cardiac arrest has increased dramatically. Age, old, as you saw on that slide before, any age. Risk factors, overweight, smoker, high cholesterol, that is a risk factor, but sometimes there's no known risk factor, okay? Medical history, you've had a heart attack in the past, yes, that can be true, but often there's no cardiac history, okay? Presenting symptoms, chest pain, dizziness, often no symptoms. Women are different. Sudden cardiac arrest, heart disease kills more than people every year than cancer. 1 in every 4 deaths is cardiac related. Every year, 230,000, and this is from, I think this is from 2009, and I know that's increased. People have a cardiac arrest outside of a hospital, and only 7.6 will survive. That was back before they started doing CCC because people didn't want to get involved, didn't want to help. Cardiac arrest survival as of Arizona 217, research conducted found that survival rose to 33.7% in those treated with bystander CO CPR, which is chest compressions only CPR. Bystander CPR and using an AED saves lives. A regular heart attack is a circulatory disorder. Blockage to the coronary artery. Person is usually conscious and they're complaining of chest pain, upper body discomfort, or pain. Now, cardiac arrest is an electrical disorder. Maybe their heart stops. They have what they call atrial fibrillation. The person is unconscious. They will go down, boom, right in front of you. They'll be talking to you in the next minute. They're out of the chair. Often no previous symptoms. Person may be gasping or not breathing at all. Often a cardiac arrest occurs due to a heart attack. I want everybody to know here, if you have a family member that is complaining of chest pain, irregular heartbeat, please do not drive them to the hospital. I don't care what they say. You call the 911, you get an ambulance there to take them to the hospital. What are you going to do if that person in your front seat all of a sudden passes out while you're driving them to the hospital? By the time you get to the hospital, they could be gone. Where if they're in an ambulance, there are things that they can do. They're in contact with the hospital the whole way. Okay? I started my nursing before they had paramedics that could do that. Now they save more lives because they are in direct contact with the hospital. They can give medications, they can do CPR. They also have special equipment that can do the compressions for them while they're driving the people to the hospital. It's called the Lucas apparatus. You can look it up on YouTube. If you see someone coming out of a house with that on, that's what that is. Whoops, sorry. What did I do? There it is. Okay, heart attack or heartburn. Heart attack is sudden pressure, tightening pain, squeezing in the chest, lasting more than a few minutes. Pain spreads to back, neck, jaw, arm, especially the left arm. Feeling lightheaded, cold sweat, trouble breathing, shortness of breath, tired for days to weeks. Women experience a little bit different. Women are going to have the jaw pain. They're going to have what they call referred pain to the back. They're going to be exhausted. They're going to have the cold sweats. Okay? They present differently. That's why sometimes they ignore that they're having an issue. They want to clean the house because if they call the paramedics, they don't want them to see the dishes out there at the kitchen. No. If you're that bad, sit down, call 911. Okay? Check it out. I've been there. Been there, done that. Heartburn. Sour taste in your mouth. You just ate. Noisy stomach, gas. Burning feeling in the chest, usually below the breastbone or ribs after eating, and that usually goes away. Bloating, burping, no pain radiating to the shoulder, neck, or arms. Okay? Primary cardiac arrest. Heart stops pumping. Blood in arteries is full of oxygen. Often unexpected witness collapse. Secondary is heart stops pumping due to lack of oxygen, like in a drug overdose, drowning, or choking. That's when you're going to have to do respirations. Okay? Approximately 70 to 80% of all adult cardiac arrests are a primary cardiac arrest. Okay? Know the symptoms. Women are more likely than men to have heart attack symptoms in addition to chest pain. And that's the sweating, unusual fatigue, upper back pain, shortness of breath, dizziness, and lightheadedness. Okay? If you have those symptoms, don't hesitate to call. Abdominal discomfort, jaw pain, nausea and vomiting, neck and shoulder discomfort. And I'm not talking that you've been out planting in the garden and you come back and your shoulders are sore. I'm talking about fatigue, an unusual fatigue that you've never had before when you've gone outside. A method of resuscitation developed through extensive research, like I told you, University of Arizona Sarver Heart Clinic. Continuous forceful chest compressions to circulate the person's blood to their brain and heart. Rescue breaths is not necessary. If you see them go down, they still have air in their lungs. They also have blood that is oxygenated in their system. What you're going to be doing is circulating that oxygenated blood to pick up more oxygen. So you have 10 minutes of oxygenated blood to circulate to keep them going until you get help. After 10 minutes, you're going to need to give breaths. Interruption of chest compression stops blood flow to the brain. Increased pressure in the chest decreases blood return to the heart. So with CPR, you would do 30 compressions and then you'd have to stop to give breaths. Well, you don't have anything circulating to the brain. It takes you a few compressions to get that blood flowing to the brain, and then you stop, and then you have to do it again. So they have found that by doing compressions only, you keep a constant blood flow. The thing is that you are still doing compressions all the time. Okay? You see where I say that it takes you a few minutes or a few compressions to get the blood pressure up, and then it drops again because you stop to give breaths. What stops people from doing CPR? Fear and concern, mouth to mouth, harming the person, legal consequences, won't perform it properly, physically unable. Solution, yuck factor is chest compressions only. Better than dead. You can't fix dead. Dead is dead, okay? Legal consequences, Good Sam law is all over the United States. As long as you don't expect recompense from the person you're helping, Good Sam will cover you. As long as you are only doing what you're being taught in this class. If you go above and beyond that, Good Sam ain't gonna help you. Okay, even a good lawyer won't help you. Won't perform properly, it's easier to do. You don't have to remember. Now, is an infant 1 in 5? Is a child 10 and 3? Is he a child or is he a teenager? You don't have to guess. Everybody has the same compressions. Physically unable, do your best. Not everybody is going to be perfect. I've been a nurse for 45 years. I may miss a compression. It's hard to do. Don't worry about it. Do the best you can. Call for help. That is the first thing you're going to do. You're going to call 911. In some of the videos, it tells you to call the emergency access, whatever it is. In the United States, it's 911. If you go to Europe, it may be a different number. If you go to Canada, it may be a different number. It may be 711, but find out what those numbers are so that you know if you need to call for emergencies, you know what the numbers are to call, okay? Chest compression only, someone who unexpectedly collapses and is unresponsive, and that's a vast majority. Traditional CPR, you've got to do it for drowning, choking, drug overdoses, children less than 8 years of age. When in doubt, do compressions. If you don't feel comfortable, and I know this happened with COVID, nobody wanted to do breaths. Put a mask on and do compressions. You don't, even if it's a drowning, at least you're doing something. Something is not nothing, okay? When you call 911, say, I just had surgery. I can't get down. I can't do anything to help this person. You know, but stay with them. Do not leave them. That's desertion. Okay, don't just see him and say, oh, he's down, I can't help him, I'm out of here. Call 911. People are going to walk by and gawk at you. And you're going to say, hey, you look like you can help me. Why don't you help me save this person's life? I can't get down. You got a cane and you can't get down because you had knee surgery. Come and help me save his life. I've called 911. They're going to be here soon. Please help me. Okay? Guilt is good. Okay? EMS arrival, it takes that much longer, or not that much longer, but we're below that. We got an award for how fast we respond. No CPR, they're gone in 10 minutes. Okay? Traditional CPR, and then CCO. That is their survival, because people start doing it sooner. They don't question it, they just go and do it now. Gasping is a sign of cardiac arrest. A majority of people with cardiac arrest gasp, and I explained that to you. Can be a sign of minimal but adequate blood flow to the brain, but it's not enough. Do not stop chest compressions if he or she gasps. And I'm going to tell you the truth. I have been to many codes. They will not respond. Okay, you're going to hear the gasp, but they're not going to respond unless they were choking. And when you do the compressions, whatever they were choking on popped out, they may start breathing again, and they may respond then. But if it's a true cardiac issue, they're not going to respond to you, okay? They're not going to say, oh, thank you, I'm going home now, and get in their car and drive away. Ain't going to happen. That's why you call 911, What to do? 3 C's. Check, shake, and shout. Call 911, send someone for an AED if available. Compress chest at least 100 times per minute. You all heard the song Staying Alive, Staying Alive? That's what you can sing to yourself. That is the rhythm. Staying alive, staying alive. There's another one, but I don't want to hear it when someone's doing compressions on me.
What is?
Another one bites the dust. No, I don't want to hear that when someone is over someone doing compressions. Another one bites the dust. No. Staying alive is good. Okay? How to do chest compressions. You're going to kneel beside them, place the heel of one hand on top of the other one, lock your elbows, aim for the middle of the chest on the sternum and the pit line, push hard and fast, take turns with another person when you're tired. If you're the only one there and you're tired, sit back a few minutes. It's okay. Catch your breath. Then start trying again. Okay? And trust me, when you're in that situation, your adrenaline will kick in. It's like people that can lift cars and things off of people. That's the kind of adrenaline that you'll get when it happens. When you're here practicing, that adrenaline isn't there. Okay? You're on a mannequin. That's really not necessarily going to be there. Okay? At least 100 compressions per minute, at least 2 inches in depth. You're not going to be able to measure 2 inches. But what's nice about these mannequins is that you're going to be able to see lights lit. When you do it, it's going to be here. And what's going to happen is when you start doing the compressions, it's going to be hard. Your body is designed to protect your heart. You have a rib cage. It protects your heart and your lungs. So what you're doing is when you start compressions, you're going to get some relief because what's going to happen is it's going to separate the cartilage. You ever crack your knuckles, guys? Okay? That's what you're releasing is the cartilage. It's going to be easier for you to compress it because what you have to do is compress the sternum, which is this part, the thicker part, against your heart and against the backbone. So you are pushing the heart because you have to squeeze the blood out of the heart and allow the blood to return to the heart because it's going back to the lungs to get oxygen. Okay? So that's what's happening, and that's why, and when you first start, it's going to be a little bit more difficult. And once you get the rhythm, it's a lot easier. Now, we have automatic external defibrillators. In this community, we have them all over. The rec centers all have them. I think the marshals on all the carts have AEDs. I know they're in the pro shop. Okay? The swimming pools have them. The exercise rooms have them. Right out here at Kuntz Rec Center, right outside the theater, there is an AED. What's really nice about that is there is a phone right next to it. It's an emergency phone. It's not red, but it's an emergency phone. You pick that phone up and it tells you exactly what to do. If you are calling 911, just dial 911. It's going to, when you call 911, it's going to ask you on fire, medical, or police. And you're going to say medical. They're going to ask where you're at. Well, some people don't know the exact address of Kuntz Rec Center, or the theater, but it says right there the physical address, Kuntz Theater. You've got that right there. It's the same way at the ballpark. It's the same way at the tennis courts. It's the same way at the pickleball courts. It's the same way with all of the rec centers. There is an area where they have a phone that you call, and it has the exact address. Okay? So when you call 911, it'll have the exact address for you to use. And it is a landline. All those lines that are out there are attached, and it's a landline, so they would know possibly where you're calling from. Okay? It's safe, it's easy, it's voice prompted. And if there's any doctors in the rooms, excuse me, we could even teach doctors how to use them. Okay? Now, they may have a medication patch, like this gentleman has, or a pacemaker, like that gentleman has. They could also have a medication port. All you do is place the pads below them. Do not take the patch off. In the AED kit, there is going to be a pair of gloves for you to use. Okay? If they're hairy, like Chewbacca there's going to be a razor in there. You can shave a little area from where the pad needs to stick. You only need to shave about that much because they're little electrodes about that big. So all you want is enough shaving so that the pad around it sticks to the chest. Okay? Jewelry, don't take jewelry off. Just swing it back. It's not going to affect the AED. When a shock is delivered, it's going to go from pad to pad. It's not going to go anywhere else. It's not going to go down into the ground. It's not going to go up in the air so you get shocked. The only way you would get shocked is if you were touching that person with something that you have around your neck. If you've got this around your neck and you're leaning over them and it's touching them at the time you push the button, you could get a shock. So you want to make sure that everybody is back away from that person when you do the shock. Okay? Also, med ports are the same way. Med ports used to be metal. They're not anymore. You can just move it below it. Okay? Let's see. We probably will not have child pads in our AEDs because we usually don't have children here, but you can use an adult pad on a child if you need to. Now, if they're at the swimming pool and you get them out and you need to use an AED on them, you just need to dry them off. People that have had a heart attack, they're going to be damp. All you need to do is you're going to take their shirt off at that time. You don't have to do it while you're doing CPR. You're just going to take their shirt off and just make sure they're dried off before you try and put the pad on. Even if they've been in the pool, you can lay them out on the deck and there'll be water underneath them and you may be kneeling in water. All you want to do is keep the AED up out of the water. You're going to keep it in its case because it will still work because it's going from pad to pad. The water is not going to affect where that electrode goes to. It goes from this pad through the heart to this pad. Okay? And children, you're going to be able to do front and back. Okay? Because you don't want it to touch. Sorry about that. I have a mic on. This is Kuntz Rec Center. As you can see, the phone next to it, and then that white information sheet is the address where you're at. It's Beardsley Rec Center. There it is. And all the things that you're going to need are inside that AED. You unzip it. It'll have gloves in there. The pads are in there. The razor's in there if you need to use it, those kinds of things. There's even scissors that a lot of people wear golf shirts. You're going to need to cut the golf shirt up. Women who wear women wearing bras, you don't need to try and unhook it. You can just lift it so it's out of the way because all you want to do is be able to place the pad here and here, where if they have a bra on, you're not going to be able to place it correctly. So just lift it up out of the way. You're going to have gawkers. Shame them into leaving. If that was your daughter, if that was your wife, if that was your husband, would you want someone staring over them? Okay? Please leave or have them turn their backs. Protect them. Okay? That's Palm Ridge pickleball court. And there is one at the new pickleball court next to the men's club at R.H. Johnson. I don't know that there's a phone there, but there is an AED there. And as you can see, the emergency 911 calls, Sun City West, Arizona, Palm Ridge Rec Center, pickleball courts. Stay on the line. When you send someone...
What would you do if you see or hear someone collapse who is not responsive? you know to call 911. But did you know that if you start continuous chest compressions, the new CPR without mouth-to-mouth breathing, that you will double the person's chance of survival? Continuous chest compression CPR is a new technique that is easier to learn, easier to perform, and more effective than traditional CPR that recommended rescue breathing. And you do not need to be certified to perform this life-saving procedure. If you witness someone collapse from sudden cardiac arrest, taking prompt action could save their life by following these simple steps. First, place the person on his back on a hard surface. Check for responsiveness by shaking and shouting at the person or rubbing their chest bone hard with your knuckles. The person's clothing is not removed. Next, command someone to call 911.
Call 911.
Or make the call yourself. Then begin chest compressions.
You aim for the center of the chest, usually between the nipples. You put the heel of one hand there. You put the heel of the other hand on top of there, and you lock your elbows. And the reason for that is that no one is strong enough to do 100 compressions a minute. And then you put your shoulders immediately over the center of the chest and you fall, compressing it about 2 inches.
It's important that the hands are lifted from the chest after each compression.
Now that's because the recoil of the chest, that causes a little vacuum in the chest, causes air to go in and blood to come back.
It's also important to pump on the chest fast at a rate of 100 times per minute. An easy way to maintain that beat is to think of a disco song like Stayin' Alive by the Bee Gees.
It turns out that if you try to do 100 times a minute, even if you're not perfect, you have the best chance of getting the most flow.
It is a jab, 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 rapid pumping action to move that blood forward to the brain.
Dr. Gordon Avey and Dr. Carl Kern are the pioneers of continuous chest compression CPR. Both are cardiac researchers at the Sarver Heart Center in Tucson and professors at the University of Arizona College of Medicine. They explain with continuous chest compression CPR, you don't check for a pulse, clear the airway, or do mouth-to-mouth breathing. All you do is pump on the chest.
In cardiac arrest, the heart is actually fibrillating and not pumping any blood forward at all. So it's only when you press on the chest that you're squeezing the heart and making a heartbeat. So your chest compression, each chest compression, is their heartbeat. And if you stop for anything, blood flow to the brain stops.
These chest compressions should be performed even if the victim is gasping.
Gasping is a sign of cardiac arrest. And we have so many people that tell us, oh, my husband was snoring last night, woke up this morning and he was gone. So that gasping is critically important. It's been reported to occur in 55% of cardiac arrests.
And don't worry, this pumping action won't hurt the victim.
They're dying. They're soon to be dead. And no matter what you do, you can't make them worse.
Better to break a rib than to let somebody die. I think they'll all be sore, but they'll be happy to shake your hand and thank you.
Studies show continuous chest compression CPR is more effective than traditional CPR for individuals who suffer sudden cardiac arrest. Dr. Kern explains why.
I think there's really 2 major reasons. First is that more people will do it. It's simpler, it's easier to remember, and frankly, it's not so intimidating. And secondly, we learned that attempting the mouth-to-mouth breathing is not without its own cost. Most lay people in seriousness cannot get the breaths in anyway.
But isn't ventilation necessary to provide oxygen to the blood?
If it's an adult who collapses by primary ventricular fibrillation, they typically have enough oxygen already in their body. It's a matter of circulating that oxygen to the tissues that need it. Most importantly, the brain and the heart, so you can respond to treatment.
For every minute you delay CPR, the survival rate drops by nearly 10%.
So if you wait 5 minutes, there's less than a 50% chance now of surviving.
That's why it's critical to pump on the chest continuously without stopping until paramedics or medical assistants arrive. Of course, that can get tiring. So if another person is available, have them take a position on the opposite side of the patient so the 2 of you can alternate chest compressions. And remember, you do not have to be certified to provide this life-saving technique. Because of the Good Samaritan laws, you are not at legal risk. Every minute, someone dies from sudden cardiac arrest. It's the #1 killer in the United States. It can happen to anyone, anytime, any place without warning. And your best chance for survival is if someone does continuous chest compression CPR. But it's very important to note that continuous chest compression CPR is not for infants or small children or for someone drowning. Here, the best approach is chest compression along with mouth-to-mouth ventilation. But even then, something is better than nothing. Continuous chest compression CPR may very well make you a lifesaver. For more information about continuous chest compression CPR, visit the Sarver Heart Center website at the University of Arizona or the State of Arizona SHARE website. This is Ann Peterson reporting.
If you see that they have a pacemaker or they have a defibrillator and the family says, oh, he's got a defibrillator, guess what? It's not working. You still need to, it's not going to hurt by doing the shock, it's not going to hurt that pacemaker. Okay, we need the AED. Yes.
Could you walk through a sequence of steps? If you're in a I've had this happen, by the way, not to me, but if you're in a restaurant and a person at the next table obviously is choking on food,
right.
What's the sequence?
The sequence is that if you ask them, are you choking? I am trained to help you. You can do the Heimlich maneuver. Okay? And that's going to be here, okay? With your thumb in here.
What would you do if you see or hear someone collapse?
Hold, please.
What would you do if you see or hear someone collapse who is not responsive? You know to call 911. But did you know that if you start continuous chest compressions, if you see someone collapse who is not responsive, without mouth-to-mouth breathing, that you will double the continuous chest compression CPR. Continuous chest compression CPR is a new technique that is easier to learn, or easier to perform, and more effective than traditional CPR that recommended rescue breathing.
Okay, now let's try it. Okay. So you would do what they call the Heimlich maneuver. Okay, you would get behind them, and you want to be sure that your leg is here. You can get them up out of the chair and bring them over, you know, so that you're standing behind them. And you're going to balance yourself, because if they do go down and they pass out, by that time, you'll be able to slide them down. But what you're going to do is this. Up, up, up. Because what's going to happen is, because they have not been able to breathe, they have built up pressure behind that. So if you do it correctly, it's going to pop out just like someone hit a bellows that's been corked. Okay? And they'll start breathing, and they should be better. But you tell them you really need to see a doctor. You can call 911, and they will come and check you out. But you don't know what they choked on. They could have scraped their esophagus. They could have torn something. They could have hurt themselves inside. So they need to really see somebody after that happens. My dad did that at, he worked for Ford Motor Company, and he was in the cafeteria. And he did that for a woman who was choking, but she was so embarrassed that she ran out and left. And he didn't know what happened to her. But it's one of those things where you really have to, especially with children, if they're choking, you want to be sure they get checked out by their pediatrician. You want to have them call their doctor. I choked, you know, and someone saved me by doing the Heimlich maneuver, which you can call it the Heimlich maneuver again. Doing Heimlich. And he may want you to go to the emergency room to get checked out. Okay?
Thank you. I know it's a little off topic, but
no, that's fine. That was, you know, it's one of those things where you can do it on yourself, okay? If you have a chair to lean on, if you're choking, you can throw yourself on the edge of the chair, and that might help get it up also. Because this is kind of hard to do on yourself. Now we have an AED video to show you.
What should you do if you see someone collapse who is not responsive? You know to call 911 and do continuous chest compression CPR. But what if you're in a place where an automated external defibrillator or AED is available? The availability and prompt use of an AED have been shown to save people's lives from sudden cardiac arrest. Dr. Gordon Avey and Dr. Carl Kern are the pioneers of continuous chest compression CPR. Both are professors at the University of Arizona College of Medicine and leaders of the Resuscitation Research Group at the Sarver Heart Center. They will demonstrate what you should do if a person collapses unexpectedly and is not responsive in an area where an AED is available. First, shout and/or forcibly rub the person's chest bone hard with your knuckles to determine if the person is unresponsive. Command someone to call 911.
Call 911!
Or make the call yourself. Then, if an AED is available,
Hey, there's an AED upstairs. Go get it.
tell someone to get the AED while you begin continuous chest compression CPR. Using the AED is fail-proof. Just turn it on and follow the instructions. The voice prompts will walk you through each step.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Oh, we don't need that, okay.
When patient's chest is bare, remove protective cover and take out, look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. Press firmly to patient.
Note that one electrode pad is placed just below the right clavicle and the other on the left side, just below the level of the breast. If a straight line were drawn between the two electrodes, it would pass through the center of the heart. The electrodes will analyze whether a shock is necessary.
Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button. Shock delivered.
Regardless of whether or not the AED delivers a shock, resume chest compressions until paramedics arrive.
Be sure emergency medical services have been called.
One of the most important parts in our program is that we recommend immediately after the shock is delivered, not to wait, not to reanalyze, but to begin compressions right away.
Dr. Avey, what is happening to the heart during cardiac arrest, and how does the AED work?
If you have a cardiac arrest, a very common problem is an electrical problem where some of the muscle is contracting and some is relaxing, and so it stops immediately pumping blood, so blood flow to the brain stops and the patient collapses. So what the AED does, or what the defibrillator does, that the paramedic does, is it puts a shock through the heart, depolarizes them all at once, so then they can start beating normally again.
How does the AED and continuous chest compression CPR work hand in hand in saving someone's life from sudden cardiac arrest?
When someone fibrillates, early on, if you shock it, that's all you need to do, and that's why automatic implantable defibrillators work, etc. But if they fibrillate and nothing happens for a long period of time, the muscles don't have enough energy and blood, and they get weaker and weaker and weaker, and if you shock them, then nothing happens. So what cardiac massage does is keeps perfusing the heart, so it fibrillates, so that even 5 and 10 minutes later, if it's fibrillating, you shock it and it survives.
While training and practice is useful, you do not have to be certified to provide continuous chest compression CPR or to use an AED. Because of the Good Samaritan laws, you are not at legal risk.
Press the flashing orange button. Shock delivered.
Sudden cardiac arrest can happen to anyone, anytime, any place, without warning. By knowing continuous chest compression CPR and how to use an AED, you can be a lifesaver. For more information about continuous chest compression CPR and the use of an AED, visit the Sarver Heart Center website at the University of Arizona or the State of Arizona SHARE website. I'm Ann Peterson reporting.
Do you only press the red button once?
Yes, and it'll reanalyze in 2 minutes. Okay? The other thing with the choking person, if they do collapse, you'll start doing compressions on them, okay? And that might pop it out also. Yes, you had a...
So it reanalyzes, well, what happens if it, after it reanalyzes, does it say hit it again, or does it say nothing?
Well, what'll happen is, even if it's analyzing the heart and it says no shock advised, it may not be a shockable rhythm. Things happen in this community that maybe they've had quite a few heart attacks and the heart is scarred and it's just done working, okay? It may not have a rhythm that you can shock. You just go back to doing CPR because there are other things that they can do.
After 2 minutes of analyzing,
what you're going to do is you're going to do compressions, and after 2 minutes, they're going to have you stop doing compressions, and it's going to say analyzing. No one touched the patient. So it'll happen every 2 minutes, and you're able to do 3 shocks.
okay.
It's usually how long the battery lasts. Okay? So you would do...
It'll tell you shock again.
Yes, and it'll say either it's shockable or not shockable. It'll reanalyze, and maybe it took care of the problem with the first shock, and it'll say no shock needed. Go back to doing compressions, because it could be an issue where they've got to get them to the hospital. Maybe they need a stent placed. Maybe they need medications. Maybe they need special treatment to the heart. You don't know because it's not going to tell you. It's just going to tell you that there's no shock needed. It will not load up for a shock, so somebody can't accidentally push that button and shock you while you're doing compressions. It just won't load up. Okay? Does that answer your question?
Yes.
Good. Anybody else have good questions? Yes?
In this community, because we have so much heat, if somebody goes down, they can get burned. If you're on that ground very long, is there something we should?
Burns can be treated.
Oh, so there's nothing we should try to slide? I know we can't move them.
If they're down on the ground and they're at an odd angle, they fell off a bike, you're not going to move them. Burns can be treated. If you move them and they have a broken bone and it slices an artery,
Okay.
they're gone, okay? You do need them to be on a flat surface if they've collapsed. Don't pick them up to carry them to a grassy area. There aren't that many here, okay? Just please leave them the way they are and call 911. Tell them they fell off their bike. I can't get them flat enough to do compressions. They are breathing, but they don't look good. Okay, you only are going to do CPR or CCC if they are not responsive and they're not breathing. If they are breathing, leave them alone and call 911. Okay, they may respond to you. You're going to be firm. And because people have these, but they don't want to wear them. They have to charge them, or they haven't put the new batteries in. They can't hear well. So you're going to be doing, hello, 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 are you okay, are you okay? This is where you're going to do a knuckle rub, right here. Sorry about that. Hello, are you okay, are you okay? But you're only going to do this and this. Don't slap them in the face. That is called assault. You can do this, hello, 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 and you can do this because you're trying to get a response from them, but if you strike them, they could call it assault. Trust me, this is a litigious society, and you don't want to take any time. I was just sleeping. I was just drunk. I don't know why you had to slap me in the face. This is what I'm saying. You have to be very careful. And if they don't respond to that and their chest is not rising and falling, then you're going to start CPR. But if they're breathing and you come up and do this, hello, are you okay, are you okay? And they swat your hand away, they're just sleeping, or the heat got to them, and they may need to be cooled off type of thing. You still call 911, you just watch them because they could stop breathing. their heart could stop because of the heat. Okay? I see a lot of people walking in this community and they are not carrying water. I don't understand it.